Today, we are talking to Lindsey Wineholt. She is a speech pathologist at UT Health at Austin. And I asked Lindsay to join me today because I wanted to continue the conversation about primary progressive aphasia. This is actually her specialty area. Technically, it's in all neurodegenerative disorders. And we'll let her explain a little more about what that means. Even though each of you are likely just in the aphasia community, I wanted to expand your knowledge to others who also have communication challenges. And that's why we're going to talk about dementia, primary progressive aphasia, and maybe some other conditions. Help me welcome Lindsay.
Welcome to the Listen for Life podcast with Genevieve Richardson. Genevieve is a speech-language pathologist rehabilitating adults with communication challenges after a stroke or due to a neurological impairment. Get equipped with knowledge from experts in the field and professionals you need to know. We'll hear stories and experiences from others who are navigating life with aphasia. So, put your earphones in and take a walk outside. This isn't just a podcast. This is a community, a resource, and a support system. We're in this together. Do life.
Welcome, Lindsey Wineholt, to the show. I'm so appreciative of you taking the time from your busy schedule to join us.
Thank you for having me.
So let's dig in. You are a speech pathologist and you work at UT Health at Austin. Can you tell us a little bit about your journey into speech pathology and then what your specialty area is?
Yes. I'm the speech language pathologist at the Comprehensive Memory Center at UT Health Austin. We specialize in seeing individuals who have neurodegenerative disorders. My journey into speech language pathology came a little later in life. This is a second career for me, but I have always been interested in language. I've always been interested in communication and working with people. I find people very interesting. Um, and so I used to, I was working kind of a desk job before and decided to take the plunge and go back to graduate school and do all my prerequisites. And that initially, I actually thought that I would work with kids. I like kids. They're great. But during graduate school, I ended up working in a research lab at UT with Dr. Maya Henry and doing treatment research with individuals who have primary progressive aphasia. And so that kind of started my career path on working with folks who have PPA. And so now that's a big part of what I do here, which is great.
Yeah. And when you and I met some time ago, I was really impressed with your very comprehensive program there at UT Health. And that, can you tell us a little bit about how your program works and the kinds of clients that you see?
Yeah. Yeah. So we are an outpatient clinic. And it is an interprofessional team. So we have lots of folks on the team. We have physician assistants, we have neuropsychologists, we have social work counselors, we have me, a speech language pathologist. And we work together to give people who are experiencing cognitive or communication difficulties, right? We can give them a diagnosis and or provide treatment for them once they have a diagnosis. So they can come to us for either or, if you're suspecting you're having trouble with memory or speaking or something like that, you can come to us to kind of figure out what's going on. Or if you already have a diagnosis, you can still come to us to see me, for instance, speech language pathologist, or come see the social work counselors for some counseling, or, get follow-up medical care here as well, sometimes depending on with you. So the majority of folks that we see, I do see a lot of individuals with primary progressive aphasia. I also see a lot of folks with Alzheimer's, dementia, Parkinson's disease, vascular dementia, Lewy body dementia. I even see some folks with cortical basal degeneration, lots of things, but all of them are progressive disorders that I see. So it's pretty specialized.
Yeah. Can we talk real specifics now about primary progressive aphasia? How would you describe it? And are there some subtypes that we should talk about?
Yes. So primary progressive aphasia is a neurodegenerative disorder. So it's a brain disorder that gets worse over time. And in the initial stages, and usually continuing on after that, language is the predominant difficulty. So it's not memory, right? It's not that you can't remember things, it's that you can't get the words out or get the words in potentially. And so usually PPA, it starts, symptoms might start in your, 60s, late 50s, early 60s. Usually it's a little bit earlier than you might see with someone who has an Alzheimer's type dementia, which usually comes later in life. And it starts gradually and then continues to worsen over time. Often I hear folks say that it's hard to get a diagnosis because there isn't this acute, all of a sudden, immediately, I can't say anything, right? It is this gradual onset of symptoms. And so I think that, and then, PPA also is a more rare diagnosis. I think it's becoming more common, but it is a more rare diagnosis. And so I think often, people will come to me and say, I've been working for years to get a diagnosis and finally got one. So, I think that just presents a challenge in and of itself, right? In terms of what PPA looks like, there are 3 different subtypes of PPA. I can't remember the exact statistic, but it's about 30 to 40% of people who don't fit neatly into these different categories, right? So there are different subtypes, but mind you, you can just have PPA and maybe you're not sure which subtype you might fit into. But the 3 subtypes are the non-fluent agrammatic subtype. There is a logopenic subtype and then a semantic subtype. So I'll start with the non-fluent agrammatic subtype. Folks who have this type of PPA, they have difficulty with what we call motor speech. So they usually have trouble, they might know exactly the word they want to say, but they can't move their mouth the right way to be able to say it, right? Their mouth and their brain are not cooperating. And they might have trouble with grammar. So they might be leaving out the small words in a sentence, right? So instead of saying, my name is Lindsay, they might say name Lindsay, right? That's all they can get out. On so the next type that I mentioned is the logopenic type of PPA. This looks pretty different actually than a non-fluent agrammatic, even though it's still a PPA. These folks have trouble with word finding, coming up with the right word. And the reason is that these people are having trouble putting sounds in the right order to make words. So they know what they want to say, they just can't come up with the right word. They might be able to come up with a word that sounds kind of similar, or maybe just substitutes one sound, right, in a word. So they might be trying to say the word kite, but they accidentally say fight. So they're making kind of these sound substitution errors. They also have a lot of trouble with repetition. So if you give them a sentence and say, repeat after me, that would be hard for someone who has logopenic PPA. The third type of PPA is semantic PPA. And so these folks also have trouble coming up with the right word, but for a different reason than the logopenic type. The semantic type of PPA, they are actually losing the meaning of words. So they likely won't be substituting sounds, right? They might be giving you a word that is similar in meaning to the word that they're looking for, but not quite right. So instead of saying, can you pass me the strawberries? They might say, can you pass me the apples? Right. strawberries and apples, they're similar, they're both fruits, but they're kind of substituting that kind of error. Or these folks usually have trouble understanding single words because they're losing the meaning, right? So you might say a word to them and they might say, I have no idea what that is. So, can you pass me the asparagus? What's asparagus? Right? I've never heard of that. Whereas that likely would have been a word they would have known previously. So the folks with semantic PPA tend to use a lot of non-specific language. So, that thing and the stuff and the guy and the this and the that, right? So they're giving you a lot of words, but you might not know exactly what they're talking about because it's so non-specific, depending on where they are in their PPA journey.
Those were great explanations. And succinct and easy to kind of visualize. Like I can see somebody in front of me. And because I work with aphasia and chronic aphasia, I try to make comparisons between the aphasias and a PPA. Yes, you kind of can, but PPA is kind of its own.
Yeah, absolutely.
Now, what is primary progressive apraxia of speech?
Yes, that is a newer diagnosis, and it really came out of the folks at Mayo Clinic. So they were noticing that there were these individuals who, came in with a primary progressive aphasia diagnosis, but really they didn't have any trouble with language, right? We're talking about language is how we communicate that starts at the brain, right? We put words together, we put sentences together, we communicate with our face, right? Our facial expressions, our gestures, that all can be described as language. What they were seeing though is these people had trouble communicating because they had motor speech difficulties. So they were having trouble moving their mouth and their tongue and their lips and right, all of that, say the words that they wanted to say, right? They knew exactly the word they wanted to say. They just couldn't move their mouth in the right way to say it. And again, it's a gradual onset, right? And it progressively gets worse over time. But what they were seeing is that these people actually don't have any trouble with language. They don't have any trouble coming up with words. They don't have any trouble with grammar, right? Really, it is just that we call it apraxia of speech, that motor speech. They're having trouble. Yeah, that motor coordination piece was really difficult. And so that is a newer diagnosis that we're seeing. And these folks really have, you know, a hard time because similar to the non-fluent agrammatic subtype of PPA, similar, but they're not having any trouble with grammar, like I talked about, like putting together sentences, that kind of thing, right? It's just that motor speech component. Um, yeah. So I'm seeing that pop up, and I'm seeing a couple of people who have PPAOS, primary progressive apraxia of speech right now.
Okay. Can we talk a bit about as a speech pathologist, how would you describe their course? And again, we're painting with a broad brush. We're not going to break it down by subtype or anything like that. But how can we as speech pathologists support someone who has primary progressive aphasia?
Mhm. Yeah, I think it is because it is a progressive disorder, so it is going to worsen over time. I like to tell folks that, we are on this journey, right? I am part of your care team now. And so I kind of subscribe to the method of we're going to work together right now. We're going to work on the goals that you need to work on right now. And then we're going to take a break, right? And then when things change, if you're noticing that things are harder than they used to be, if the tools that you were using aren't working for you anymore, come back and see me, right? That's when we can kind of do another round of treatment. We can do a booster. We can work on different goals if that's appropriate, right? But I do think in general, seeing a speech language pathologist, I think can be helpful because we are working on what you need to work on now, but we're also thinking about the future in terms of our goals too, right? And so my goal is to make sure that you can communicate effectively with other people now and in the future. And so, what tools do you need now? What tools do you need 6 months from now, a year from now, right? 2 years from now? And obviously, we don't want to give you all of that at once, which is why this is a journey, which is why we kind of, I think we do little bits at a time, right? And kind of meet you where, where you're at today. And while also kind of thinking about the future on the horizon. Did that answer
Yeah,
the question?
yeah,
Okay.
very, very good.
Okay.
Because I think it is an interesting journey because it is different from your
Good
traditional
point.
aphasia, which is acute or, didn't have it, now you have it, versus someone who's developing a primary progressive aphasia. They might be experiencing these little symptoms here and there, and maybe it's not until they go to their general practitioner, for their annual checkup that he might say, "Oh, you should probably go see a neurologist." Or how long has that been
Mhm.
happening? Or, because I'm thinking of one gentleman in particular, he just had some issues with syllables. He would 3, 4 syllable word, he'd reduce the syllables or sometimes flip the syllables or make a substitution, and he attributed it to other things, and it took a while to
Maybe.
get to the neurologist, who did a full
I see.
comprehensive workup and, you know, confirmed the diagnosis.
No, yeah, I think more so from the people who have PPA that I've worked with, the story I hear is actually the opposite of what you just said, which is interesting. I mostly hear people say, I thought something was wrong for so long and my doctor sent me home, and said, "Oh no, I think you're doing okay." Or, maybe I told my spouse that I thought something was wrong and they said, "No, I think you're okay. I don't notice anything." More so, I hear, I did think something was wrong, but I was the only one who noticed it at first, right? And then eventually, as things progressed, then it kind of started showing up more and more where others could notice it and I could get an actual diagnosis. So, yeah, it's interesting. I think the way people get to, their care, right? Whatever that looks like to them.
What do some of the people say were maybe their first symptoms? Every individual is different, every brain is different. Just because it's a PPA diagnosis, then you can have variability within that diagnosis. Your symptoms vary. I'm just
Mhm.
curious, what kinds of things are people coming to you and saying is going on?
People talk about situations where they were communicating publicly, where all of a sudden they just couldn't think of the word that they wanted to say. So, for instance, I've worked with several pastors who every Sunday they're giving sermons, and what used to be very easy for them off the cuffs, even if they couldn't remember the exact word they wanted, they could get their message across and keep it going. But, you know, all of a sudden they started noticing, wow, I really couldn't think of the word that I wanted in front of all of these people. And that really stuck out to me, right? Or teachers or professors noticing that, or I'm in a meeting with people and all of a sudden I froze and I just couldn't think of the word. And it was so embarrassing to me. And that's when I really noticed there was something going on. So I often hear that from people. I also hear, it just took me a lot longer to get the word. That comes up too, it's just taking me a long time to think of the word I wanted. And my spouse just kept saying, "Well, what are you trying to say? What are you trying to say?" And I just couldn't get it out, right? So I hear that come up too, where, it's maybe the words come, but it might take a little longer, it just at first, but then it kind of progresses into, yeah, then the words aren't coming anymore. And yeah. So that's usually what I hear most in the beginning.
Let's take a little tangent, just a small one, and talk a little bit about counseling because it's such a huge part. Well, any communication disorder.
Mhm. Yeah. Yeah. I think, communicating is how we express who we are. Um, and so when you have a change in that, that is, it changes your whole perception of self, right? Or it can. It might not for everyone, but it can. And so I talk a lot about, with the folks I see who have PPA, we talk a lot about the diagnosis and acceptance, this is where we're at today. And I don't know what it's like to be them. I don't have primary progressive aphasia, so I cannot know, how hard that is. And I see, folks that do accept, right? This is okay. I'm living with PPA. I'm here. I have it, but that's okay, right? I can still have a good life. I can still thrive having PPA. I think I see them move forward and have and thrive, right? When they do kind of fully accept their diagnosis. And so, but that's, I don't, like I said, I can't, it's really hard, I'm sure, and it can't be forced. And so I think kind of what you're saying, Genevieve, is, counseling is a way to kind of get there to process those emotions and those feelings. This is a huge change, right? And not just for the person who has PPA, but for their care partner or partners, their family, their friends, right? Their community. And so, we have social work counselors in our clinic that often see, they really, they focus mostly on the care partners, just so caring for the care partners, but they also do some counseling with folks with PPA sometimes. I think the challenge for getting counseling for someone who has PPA is that counselor familiar with PPA? Do they know what aphasia is? Do they know how to help you successfully communicate in a counseling session if you're going, if you're going that route? So I think, that's when hopefully a speech language pathologist could be very helpful, in kind of helping either collaborate with the counselor if you're seeing a counselor, or giving you tools to share with the counselor to kind of empower the person with PPA. Hey, these are things that really help me communicate effectively. If you can do that, if you can give me extra time to respond, or if you can wait, when I'm holding my finger up, that means I'm thinking of a word, like please don't interrupt, or, if you can speak a little slower, that would be great. Just making sure that person, that counselor has the tools to also make sure that that person with PPA is succeeding in their counseling sessions if they're doing them.
I think, boy, I was thinking a lot of different little tangents off this thought about counseling. And because it is really difficult to find counselors, whether it's a psychologist, marriage, family, all the different kinds of counselors that are out there. And some family member might already be hooked in with a counselor that they know, like, and trust. So I'm wondering, can we just brainstorm a little bit about how could a speech pathologist be that kind of collaborator with the counselor, maybe with or without, whether it's the spouse that's there or the person with primary progressive aphasia that's there. How can we do this? Because you're in a unique position that you are with social work counselors that understand these diagnoses. What would a speech pathologist who maybe knows PPA but doesn't know exactly the counseling how could we help them? Or how can we provide some information here to families with PPA? And maybe they can facilitate getting collaboration between their counselor and the speech pathologist.
I'm in a unique position. I'm very privileged to work with the wonderful social work counselors that I work with. And I see a lot of community referrals who have their own counselors. And so I've had several phone calls with counselors in the community at the request of the person I'm working with. And, really, I think it's just about providing some education on what is PPA, right? What is that? What does it look like today for the person, that individual? And what's it gonna look like in the future? What are some things that maybe to look out for? I usually provide some written material. The Association for Frontotemporal Lobar Degeneration, they have wonderful handouts on their website, wonderful explanations of PPA and all the different variants and what they look like. And so usually I will send that to the counselor and or give it to my patient to give to their counselor. And I think then, when I'm having phone calls with the counselor, I think asking them, what do you want to know? What would be helpful for you to know that, and, is there anything that is impacting or impeding maybe having a good counseling session with this person? So usually I'm talking to them after they've already been seeing the person who has PPA. I think it's just kind of, yeah, I'm asking, providing education and then providing some written materials. So hopefully they can see it and remember to do it, right? Because it takes practice. And then I think I always try to follow up with my patient, and say, hey, how's it going? Have you noticed a difference, right? Is there anything else we can help support with? Happy to have another phone call if I want to, if I need to, or if you would want that. But usually in the past, it's just taken one or two phone calls. And I think, counselors want to help the people they see, right? I am starting to work with a PhD student this summer who is interested in creating either low tech or high tech to help folks who have communication disorders communicate and potentially communicate with counselors. She has done that in the past. And so, thinking about what nonverbal tools, so AAC, augmentative and alternative communication. So is there a board with different emotions, emotion icons that you could use during the counseling session that might help get things started or get your message across, right?
I think it's probably taken life experience to do a better job in general counseling regarding communication disorders with my clients. And we are trained. We do get some training in counseling, not the methods and, the extensiveness, but in the sense of we can help relate with the person and understanding their communication disorder, how that can impact not only them, but their immediate family. If they're working, how that can impact. And so we're in a unique position knowing what we know about communication to really help dig into some of these possible aspects that the person with a primary progressive aphasia or their spouse needs to talk to the counselor about. Make sure you touch on, talking to work about, what the challenges are you have and can there be modifications done at work? It all sounds fine and good for us to recommend a modification, but there's a whole lot of extra that goes with the implementation of that. And that's where a counselor, with all of their training and techniques, can really help facilitate hard conversations.
Yeah. What you said too does ring a bell. I think just being a person that understands, I think is a big deal. When you are with people, aphasia is not a common word by itself, especially let alone primary progressive aphasia, right? You say that to a room full of people, who's going to know what that is, right? And so I think you're right. There is some, yeah, relational connection, I think, and just, being someone that can potentially, I don't know what it's like to be them, but I understand, what's going on with their language, at least in that I think can be helpful. And the more you can give that to the people that person is talking about, the more education you can provide to the people that the person with PPA is talking to most, hopefully then the better environment, they're setting themselves up in to feel successful, confident, and an effective communicator, right? Which I often say that, the goal is that you're an effective and confident communicator. It might look different than it did before, but hopefully, if we can get you to be an effective and a confident communicator, I hope that can be our goal.
And something you said earlier before we officially went live on this interview, you said that acceptance is a big part, and we got that on the recording, but also that you feel like your job is to help the person and their family to still live their best life.
Yeah. In our clinic, I think we tend to try to talk about these disorders as you're living with these disorders. You're living with primary progressive aphasia, right? Just as people live with cancer, people live with heart disease, people live with diabetes, right? This is a big deal. It's a big deal to live with PPA. It's an adjustment, a huge adjustment. And you can still live your best life, right? That's what it's about, is how can I live my best life? How can I thrive as a person living with PPA? And so I think, that's that's the ultimate goal, hopefully, right? And so I often talk to folks about, I think they come in and tell me, I don't want to go anywhere. I don't want to talk to anyone. I feel embarrassed. I don't sound like myself. I don't know what to say because I get stuck and then it's embarrassing. So I just don't say anything at all. And, I think that's completely valid. That is a completely valid reaction, right? I probably would feel the same way. And right, your voice is important. As a person with PPA, your voice is still really important, and you have things to say and you have things to contribute. And so I think part of my job as a speech language pathologist is, finding strategies and tools to help you be an effective communicator, despite the fact that it is going to be harder for you to communicate. That's the truth of it. And we can get you tools, we can get you, strategies to help you communicate. So hopefully you're not, you know, pulling up by yourself, which, we know the effects of social isolation are not just mood, they're also physical. You see negative physical health effects from social isolation. And so we talk a lot about that in our sessions too. You don't have to go to a party every day of the week, right? But social isolation is important for both our physical and our mental health. And so, we don't want you to just pull up and be by yourself. We want you to be out and about, meet the people and things that you love.
That's right. And I would say that's the exact same message for people with chronic aphasia. It is still aphasia. It means it's an impairment in language. How it starts or how it progresses, that's irrelevant. It's still a change and it's still identity. It's still your own self perception. It's your confidence. It's your willingness to put yourself out there. What would you say? What would be your takeaway if you could give a message?
So I think, one message is just kind of what I said, that my hope for you, if you have PPA or have family with PPA or friends, that, they can figure out a way to live well with PPA. And I think, you don't have to do it alone. I think PPA is a more rare disorder. A lot of people don't know what it is or know about it, right? So I think that can feel really isolating at first. But that's when you contact a speech language pathologist, right? That might be a good start to reaching out to a community for you of folks who have PPA or going through something similar. There are national organizations that do a great job. The National Aphasia Association has some groups. The AFTD, like I mentioned earlier, the Association for Frontotemporal Lobar Degeneration, has a list of support groups nationwide on their website. There are different international groups even. And I think, just having a speech language pathologist kind of help guide you to resources in your own community too. There are local things going on. Even if you don't want to sit in a room full of folks with PPA, maybe they can help you come up with something else that's going to feel supportive for you in your church, in your volunteer group, in your book club, right? Whatever that might be. And the same for family and friends of folks with PPA. Y'all don't have to do it alone.
You don't have to do it alone.
Mhm.
Thank you, Lindsay. I greatly appreciate your time and your knowledge. And you could tell how passionate you are about this community and the population that you serve. And I'm just grateful to know you and call you a friend and a colleague that is supporting the PPA community.
Thanks so much for having me. It was a pleasure.
Thanks for tuning in to the Listen for Life podcast. We hope you feel empowered and supported. Head over to listenforlifepodcast.com to see the show notes with links and information from today's episode. Do you have a topic, a resource to share, or a guest recommendation? Inquiring minds want to know. Let us know in the comments section. Wishing you a fabulous week.